Bismillahirrahmanirrahim. So this is my second video regarding the gynae pink MCQs. I hope all of you are fine and enjoying good health. So resuming from the place where we left in the previous lecture. So MCQ number 20, that is a girl of 11 years was referred to X-ray department for X-ray of the elbow joint to know the age. So the X-ray of, now there is a mnemonic for this. Now if you study this MCQ and just utilize it, that is the lateral epicondyle, then you will correct it in the exam. But we have to study it smart. What is smart study? We have to see that at first year of life, third year of life, fifth year of life, seventh year of life, which X-ray will you do. So coming to, there is a mnemonic for that. That is CRITOE, crito. So C for capitulum or for radial head, I for internal epicondyle or medial epicondyle, T for trachea, O for olecranon, and E for external or lateral epicondyle. So 1, 3, 5, 7, 9, 11, just like odd numbers. And you memorize this crito, and you can pick any MCQ if it comes on this. So over here the scenario was that was of 11 year. So in 11 year that is given over here. So for 11 year, that is external epicondyle or lateral epicondyle. So the option D was correct. So the next question is, that is, what is true about osteogenesis imperfecta? This one. So that is brittle bone disease type 1 collagen defect. Coming forward, that is a simple straightforward MCQ. Female had fever, chest pain on lying. Now pain on lying that is relieved on bending forward. What is the diagnosis? Now chest pain that is on lying and that is relieved on bending forward, the answer is pericarditis. But if there is epigastric pain or abdominal pain that is more on lying and relieved on sitting forward, that is then pancreatitis. Keep in mind these two things, pericarditis and pancreatitis. In pericarditis there is chest pain, in pancreatitis there is abdominal pain that is relieved with sitting and exacerbated on lying down. So chest pain and abdominal pain were here, pericarditis. So nodule on the vocal cord on microscopic examination least likely is, now studies have shown the vocal cord nodule they are always benign. So they are talking about, we have to understand this thing. They are talking about least likely. So the answer to this is carcinoma. The answer to this MCQ is carcinoma. It is not hyperplasia. If you see a vocal cord nodule, this is usually in 99.9% it is benign. So we can expect atrophy, we can expect hyperplasia, but we cannot expect carcinoma. So the least likely is carcinoma. Another MCQ that is related to this question is nodule on vocal cord on microscopic examination most likely. If the question is a little changed to what is most likely, the answer is option B, hyperplasia. If that is replaced by most likely, then the option is option B, hyperplasia. If it is said least likely, then this is carcinoma. Option D over here, carcinoma. If it is said second most likely, then it is atrophy. So we can do 3 MCQs just on this statement. Least likely, carcinoma. Most likely, hyperplasia. Second most likely, atrophy. Coming to our next MCQ, that is regarding the heart. Now this MCQ is important. The interior surface of the heart is supplied by, now we are having two stem. Focus on my words, the statement. Interior surface of the heart, interior surface of the left ventricle. If the question asks about interior surface of the heart, we know that interior surface of the heart, 75% it is occupied by right ventricle. Right ventricle. So if the question asks interior surface of the heart is supplied by right coronary artery, but if the question asks interior surface of the left ventricle, then the answer is left anterior descending artery. So you have to focus on the stem. Interior surface of the heart, like over there, this is right coronary artery, option A. But if the question says interior surface of the left ventricle, then option B, LAD. So keep in mind. So over here the answer is option A, that is RCA, because it is interior surface of the heart. So coming toward next, the edema of acute infection. Acute infection is always exudative. That is a straightforward question. And exudate, the study has shown that the protein is more than 3 gram. That is a straightforward question. So coming next, the functional residual capacity. Now if you are studying this thing, you have to study another things with this also. So the functional residual capacity, that is very easy. That is residual volume plus expiratory reserve volume. That is very simple to pick. Now what is inspiratory capacity, what is expiratory capacity, and what is functional residual capacity, and what is tidal volume? Tidal volume mean if I am breathing normal, so the amount of air I inhale and exhale with normal breath, this is tidal volume. What is inspiratory reserve volume? Inspiratory reserve volume is if after the tidal volume I inhale fully to the full strength, then this is tidal inspiratory reserve volume. Inspiratory reserve volume mean after my tidal volume is finished, the amount of extra air that I inhale up to the maximum intensity. Like for example, this is tidal volume, the amount of air with normal breath. Now I am going toward the inspiratory reserve volume. So after the tidal volume is finished and I take in more air after the tidal volume is finished, the more air that I inhale after the tidal volume is finished up to the maximum intensity, this is inspiratory reserve volume. And if I add the two things, inspiratory reserve volume and the tidal volume, then the combination of these two things is called inspiratory capacity. So the inspiratory capacity is the tidal volume plus inspiratory reserve volume. The combination of two, tidal volume plus inspiratory reserve volume, is inspiratory capacity. And now what is meant by expiratory reserve volume? So the volume of air that I exhale after the tidal volume is finished up to my maximum intensity. Like for example, I am going to demonstrate expiratory reserve volume. So all the amount of air that I exhale after the tidal volume is finished is expiratory reserve volume. And what is expiratory capacity? Capacity always means the combination of two volumes. So the tidal volume plus expiratory reserve volume is expiratory capacity. And what is the functional residual capacity? That is the residual volume plus expiratory reserve volume. And there is another MCQ they will ask. So each of the things that I demonstrate, or each of the volume or capacity I demonstrate, each one is MCQ. Each one is MCQ. So you have to clear concept regarding that. So another MCQ related to this is, which volume cannot be measured? Which volume cannot be measured? The answer is residual volume. Residual volume. You cannot measure residual volume. I'm not going into the detail of it further, but at least you should know these things that I discussed. Now the cardiac output depends upon the venous return. Cardiac output depends upon the venous return, and cardiac output is equal to heart rate into stroke volume, but it depends upon the venous return. More is the venous return, more is the cardiac output, according to Frank-Starling law. Now there is another MCQ, that is the gas gangrene cause. In the cause of death in gas gangrene is, now answer to this is toxemia. Why? Because in gas gangrene the bacteria actually does not go to the blood and to the peripheral tissues. It is the toxin that the bacteria sends, the alpha toxin and stuff like that. So these toxins actually causes extensive destruction in the body. So this is actually toxemia that kills the person. Now the vitamin in intestine, we know that there is vitamin K, and another vitamin that is in the intestine is small amount, that is vitamin B12. But more than this is vitamin K. Vitamin in the intestine is vitamin K, and that is produced by the gut bacteria. So they ask a question related to it. The warfarin and the antibiotic. A person is on antibiotic and he is on warfarin. Which vitamin is important in this regard? So that is vitamin K, because the antibiotic kills that bacteria that produce vitamin K. So you are having deficiency of vitamin K in the body. If you are having deficiency of vitamin K in the body, so it means the warfarin effect is exaggerated with antibiotics. Antioxidant vitamin, that is vitamin E is the antioxidant. Another antioxidant vitamin is vitamin C, but they usually ask about the potency. What is the most potent antioxidant? That is glutathione. After glutathione, vitamin E. After vitamin E, vitamin C. These are the straightforward MCQs, that why I am going very quickly. Vitamin which is a cofactor for enzyme which add one carbon group, which is a cofactor and which add one carbon group, that is biotin. Sample. Coming next, DLR4 is associated with which of the following? That is rheumatoid arthritis. DLR4, these are actually the major histocompatibility complex MHC molecules. So DLR4 is associated with that is DR4, that is associated with rheumatoid arthritis and diabetes mellitus, type 1 diabetes mellitus. So with this I am sharing another chart, and you have to memorize other MCH type 1 and type 2 also. So it covers all your other MCQs that can come in the future MCQs. So this is actually that diagram, and which shows combination of what is MCH1, what is MCH2. You can clearly see, and there is a table. You can actually memorize these things by repeating again and again. So this is a table in order for you to memorize it for future MCQs. So baby born with cataract, which maternal infection is likely? That is rubella, known as congenital rubella syndrome. And what is the cardiac manifestation associated with it? That is the PDA, persistent ductus arteriosus, associated with rubella. So another MCQ that comes to my mind at this time is, what is the most common cause for PDA? Answer is hypoxia. So those who live in the altitudes, they have high chances of PDA, persistent ductus arteriosus. So the grading of tumor is degree of differentiation. That is the right answer. And the extent of tumor is staging. That is staging. So the true about neutrophil is they are phagocytic in bloodstream. This is the right answer. And the clue that is the evidence for this is chitin. It is clearly mentioned in the chitin. The neutrophil, they are phagocytic in the blood, while the macrophages, they are phagocytic in the tissues. Because macrophages, they are monocyte in the blood, they are not in mature form, so they cannot engulf. Now this MCQ is very important. Tumor that does not have mets is basically basal cell carcinoma. Another tumor that having no mets usually, that is ameloblastoma, that is of the jaw. So these are these two MCQ must be kept in mind because they are coming repeatedly. And if the question asks which of the following is locally malignant tumor, locally malignant mean they locally erode the tissue but do not metastasize to the other organs. They locally erode the tissues but do not metastasize to the other organs. So the two examples are basal cell carcinoma and ameloblastoma. In emergency, straightforward question, patient should be allowed, relative stay outside. Now coming toward this MCQ, old men repeated UTI. What is the cause of repeated UTI in old age? That is BPH, benign prostatic hyperplasia, that leads to urinary retention and that cause infection. So that is BPH. But if that is not in the option BPH, then you should pick retention. So the option over here is right. Now the highest percentage of protein in which, this is very straightforward question, that is HDL, and the lowest protein is in which, coming down to chylomicron, because they are based on the density. So the HDL, highest protein content, chylomicron, lowest protein content. For the cholesterol and the triglyceride, the reverse is true. Highest concentration of fatty acids or cholesterol is in the chylomicron and the lowest is in the HDL. What is the function of HDL? This is another MCQ. It carries the cholesterol from periphery to the liver. What is LDL? It carries the cholesterol from the liver to the periphery, to the vessel. What is good cholesterol? These are other MCQs I am narrating. What is good cholesterol? HDL is good cholesterol. What is bad cholesterol? LDL is bad cholesterol. Why? Because the HDL carries the cholesterol away from the vessel, so it actually decreases atherosclerosis, while the LDL carries cholesterol to the vessel, so it increases atherosclerosis. In women during reproductive age, what is the cardiac protective marker? That is the HDL. And the reason for high HDL in the reproductive age woman is estrogen. Estrogen increases HDL. How? By acting in the liver, produces more HDL. Straightforward question. Coming toward next, the phagocytic opsonin, that is C3b. You have to utilize it. C3b, and C3a and C5a is anaphylatoxin. They mediates and attracts the neutrophils and other inflammatory mediators. But over here, phagocytic opsonin C3b, it helps in opsonization, attaches to the antigen and allow the neutrophil to engulf it. Coming next, main regulator of coronary blood flow is local metabolism of cardiac muscle. And by local metabolism of cardiac muscle means carbon dioxide, adenosine, lactic acid. When the heart pumps more, it needs more oxygen, so it produces these metabolites, and that causes coronary vasodilation. Men with weakness and dysphagia and blood profile shows target cell. So this is clear-cut case of iron deficiency anemia, that is Plummer-Wilson syndrome. Another syndrome that is called Plummer-Wilson syndrome, that is associated with thyroid. So you should not confuse Plummer-Wilson with the Plummer syndrome that is associated with thyroid. Full clearance of which substance? That is para-aminoheporic acid, the pH. Para-aminoheporic acid, that is fully cleared. We will study it later on in other MCQs, how it measures the GFR. The cytoskeleton connected to the ECM through, now The answer to this is integrin. Let's suppose this is cell. I will demonstrate over here. Let's suppose this is the normal cell of the body, and this is the matrix. This is the extracellular matrix. So there are certain proteins which bind these two things, the cytoskeleton in the cell and the extracellular matrix. This is called what? This is integrins. The cell, extracellular matrix, the bonding is integrins. This is not intermediate filament. Purine, uric acid, simple. Purine and pyrimidine, both uric acid. Lowest oxygen content in umbilical circulation is in superior vena cava, of course. Why? Because the inferior vena cava is connected to the umbilical vessels, and which can carry oxygen, so that is oxygenated blood. The characteristic of malaria over here is that is black water fever, simple to pick.